Caring Unveiled with Jarrett Stull.
Welcome to the premiere episode of Caring Unveiled, a new quarterly program brought to you exclusively by Memorial Health Foundation. This series is our way of connecting with you, our valued supporters, and giving you an inside look at the incredible work being done to care for patients in our community. Together, we'll meet the compassionate providers who dedicate their lives to making a difference, explore the healthcare services offered right here in our region, and go behind the scenes to uncover the heart and dedication that drives Memorial Health System every day. We're so excited to share these stories with you, starting with our very first guest. I am pleased to welcome to the program the region's only cardiothoracic surgeon and chief of cardiac surgery at Memorial Health System, who will share more about the Department of Cardiology and the impact it's having on our community. Dr. Cousins, thank you for joining us today.
Thank you for having me. It's great to be here.
I can't wait to jump right into some of the things happening in cardiology, but I wanted to first start with, tell us a little bit about yourself.
Yes.
And your background.
Sure. I'm Dr. Geoffrey Cousins. I've been a cardiothoracic surgeon for the past 22 years or so. My specialty is beating heart coronary revascularization, but we offer a full line of cardiac adult surgery, everything from aortic valve replacements or repair to mitral and tricuspid valve replacement and repair. We also do coronary artery revascularization. We also do thoracic surgery, including resections for lungs and things along that line, primarily serving the adult cardiac surgery.
Well, I know in the past year since you've been with us, one of the things that I hear often that I think is your claim to fame a little bit is the beating heart surgery.
Yes.
Can you tell us a little bit more about that and some of the other procedures that you're doing?
Yes. Traditionally, cardiac surgery has been performed with what's called the cardiopulmonary bypass machine. But many years ago, we saw some issues with the machine, particularly with women. They were not doing as well as men. And people who had cerebral vascular disease or renal failure or problems with their lungs due to long smoking history were not doing as well. And so when we started to do the surgery with the heart beating continuously versus putting them on the heart-lung machine, we started to see people were doing better. The women were doing better. Those with renal disease and lung disease were doing better. And so we made that part of our permanent armamentarium, and for the past 20 years or so, we've been performing this surgery with the heart beating continuously and having very good results. For the most part, I'm the only cardiothoracic surgeon in the area who does cardiac bypass surgery routinely with the heart beating. Typically, our patients can get home within 3 to 5 days. Because the procedure is less invasive, we don't use as much blood thinners or heparin when we do the surgery, so we don't have any significant blood loss. So our transfusion rate is almost nil. And so people do a lot better and they're able to get back to their regular activities, and we're able to get them home usually within 3 to 5 days.
That is impressive that you can do that now.
Very exciting.
Right,
yes.
Right, and great outcomes. Well, I know when I've heard you talk about the Department of Cardiology before, you talk about it being a team sport. And,
yes.
And there's several colleagues that you have, and we're doing a whole host of cardiology procedures that since we've expanded that department. Can you talk a little bit about some of your colleagues and some of the procedures that our community can get done here?
Yes. One of the very exciting things is our TAVR program, and that's transcatheter aortic valve replacement. And I will do those in conjunction with Dr. Schott. Dr. Jason Schott is a very good interventional cardiologist, and we do the TAVRs together. We also have further structural heart program where we do Watchman procedures. And Watchman are procedures that are performed for people who have atrial fibrillation to cut down on the risk of them having stroke. Some of the other procedures that we do include valve repair and replacement in the open surgical setting, as well as lung surgery and things along that line. So we offer a full line of adult cardiac and thoracic surgical procedures here at Marietta Memorial Hospital.
So our community can really take care of all of their cardiology services here locally. We don't have to travel outside the area for this type of care.
That is correct. Short of a transplant, everything else can pretty much be done here. Yes.
That is fantastic. Well, I know, some of our viewers might be thinking, how do, if they need cardiology services or their loved one or family, how do they get started with reaching out to the department or with their primary care?
Yes. Oftentimes, people are referred to us from their primary care physician. If the patient shows up and complains of chest pain, or shortness of breath, or easy fatigability, swelling in the legs or the hands or feet, or if they've had an EKG performed and it showed some abnormality, then typically the primary care physician will refer them to see someone in the cardiology department. Otherwise, if you feel that you have a heart issue that you want someone to take a closer look at, then you could just call us directly at the cardiology department at Marietta Memorial Hospital, and we'll get you an appointment and take care of what you need.
Oh, fantastic. We know they'll be taking well care of coming to see you and the rest of the team. Well, I really appreciate your time today. I know our donors appreciate being able to hear more from you, to kind of unveil what's behind the care that they can get here at Marietta Memorial Hospital and throughout our health system. So again, thank you for your time and being the first guest on our show.
Oh, well, thank you. And thank you to the donors. We couldn't do what we do if those folks didn't take time to put some stake into us and to the community, and it's a very good thing to do. We encourage everyone to be a donor.
Absolutely. We have great donors that care a lot about this community and ensuring that we have the best care and treatments right here at home.
That is correct.
All right. Well, thank you very much.
Thank you. Thank you very much.
And to our viewers, thank you for tuning in and for your unwavering support of Memorial Health Foundation. As donors, you make all of this possible, and we are so grateful for your commitment to advancing the care in our region. Be sure to watch your email for the next edition of Caring Unveiled, where we'll continue to bring you inspiring stories and updates about the impact of your generosity. If there's something specific you would like to see featured in a future program, I would love to hear from you. Feel free to reach out to me directly with your suggestions. Until next time, thank you for partnering with us to make a lasting difference in the lives of those we serve. Take care, and we'll see you again soon.